We are going to move right along to our next session on what really matters, a town hall on life, living, and hope. So our moderator for this session is going to be Rachel Callander, and she's got a great panel with her for this discussion. So Rachel, the floor is yours.
It is my absolute pleasure to facilitate this conversation. We have a panel of 5 incredible parents who are going to be sharing from their very own unique perspective about what matters most. And I encourage any healthcare professional, industry representative, or pharmaceutical industry representative to really listen to these things, because the things that really matter to families are the things that are going to help drive innovation and change and will help foster that sense of hope and connection and belonging. My name is Rachel Callander. If you haven't met me, I have the great privilege of running the Lighthouse sessions with PPMD, and I am really excited for you to hear from these beautiful panelists. So we have Jen, Limca, Jen, Clare, and Chris. But first, talking about what matters most, we're going to hear from Clare about taking a day at a time, and I'm going to let her introduce herself to you.
Hello, everyone. I'm so grateful to be here with you all. My name is Clare Perrin, and I'm from Rockland County, New York. My son, Luke, is 6 years old. He's living with Duchenne, and he was diagnosed when he was 3. And he received Sarepta's gene therapy last summer as part of their clinical trial. I think when we first received our diagnosis, I think I, like many of you, are only thinking about the negative things, the physical limitations and the loss of strength that Luke would eventually face. But then as I started to meet other families in the community, it just became clear to me that there would be time to really enjoy everyday activities. Luke would have the opportunity to just be a kid and have fun. And I think being part of this community really showed me that, and it's so powerful. And just having the support of PPMD and all of you has just made so much of a difference. So I think one key thing that I believe matters most to our family right now is just really taking one day at a time, just really trying to live a little more purposefully and joyfully. I think, we're all dealing with the uncertainty of our son's diagnoses and how that's going to look with whatever treatment regimen that they're on. So, and as we are trying to figure out what our next steps are, so becoming more comfortable with that uncertainty is a huge part of enjoying the here and now with my kids. So, this is not something that comes easy to me. I'm type A, I'm a mom of 3 kids, so just like learning to appreciate each moment, each day, and be grateful and joyful has just been really impactful for us. I think we all know we have this experience of clinical trials, just, it's long, that your appointments are hours and days long, and I think Scott and I learned so much about how to distract Luke during the many appointments. I think we built robots, we have Lego sets for him, and we may have actually memorized a lot of the lines from Spider-Man movies. Just about 6 weeks after Luke received the gene therapy, he came up to us one weekday. We were making dinner and 100 things were happening. And he's like, "Look what I can do." And he was jumping up and down on one foot. He was hopping. This is not something that Luke was ever able to do. So we immediately took a video. We shared it with our friends and family. And just celebrating those physical improvements has just been really important. So, Luke just being a kid, it's just great as a parent to see. He just finished kindergarten and he has just had a great year. He did have a little bit of struggles with getting his work done, but, we worked with his teachers throughout the year and we were able to see how resilient he is and how supportive they are, which is just amazing. Our son is very much a tiny engineer. I just want to tell you about this one conversation we got into one time. He wanted to know how our house received electricity and water, and like details of the wiring and the plumbing. If I could have given him a map of the pipes underneath our house, he would have been thrilled. So this like somehow morphed into us watching YouTube videos on electricity and just really appreciating the kid that Luke is, and just celebrating that has been so impactful for us. So, you know, Luke is a Cub Scout in Pack 233. He was able to participate in things with his classmates. He played t-ball with his brother, and just taking that all into account and just living each day joyfully. And I'll just close with one little anecdote from our home experience. So Luke gets stretched every night. I'm sure you all have kind of similar regimens for your sons, but his dad does it with him. But oftentimes his siblings want to join him, so we'll go into Luke's room, and they'll all be lined up on his bed with, you know, all positioned, ready to go for Scott to stretch them, and just without prompting, just them including Luke in his and participating in his nighttime routine. I think has really been really neat to see, and just overall, our whole experience now just makes me think that, you know, helping Luke thrive and really do well is something we can do. It's not overwhelming anymore, and a lot of that is being a part of this wonderful community. So, thank you.
Claire, thank you. What I love so much about you sharing those stories is just how human you've made Luke to us, and there wasn't really anything very much about Duchenne in those stories. It's about what he loves and who he is as a person, and how even the therapy, you've made that something fun and a ritual that the whole family can be part of. So there's some really beautiful, practical ideas of bringing that sense of joy into your everyday. And so thank you so much for sharing, Claire.
Of course, thanks.
Thank you. Jen, I'm going to go to you next.
The area I was going to focus on is building community. And when I think of community after our son's diagnosis, there's really two avenues that our family worked on. I'm married to my husband, Brian, and then we have 3 children. I have a 15-year-old daughter, an 11-year-old son with Duchenne, and an 8-year-old son without Duchenne. The first transition came hard and fast, where my husband and I had already figured out how to parent together. We've been married for a long time, but we have never been medical parents. We never intended to be medical parents, so we had to make this transition quickly. First of all, I'm more introverted. My husband's more extroverted. My husband also dove into all the technical research. So when we come to the conferences, he wants to talk to all the doctors and the researchers. The areas I want to focus on are the parents who have lived experiences, the therapies, the things that are life experiences for our boys. And at one point, we both looked across thinking, you're not helping our son. And it took us a little bit of time to pause and say, we're actually providing the most holistic approach that we can by us both focusing in different areas. We've even started to leverage these strengths. So if I need a phone call made, I hand Brian the contact information and say, here you go, let me know what you find out. When he runs across something he wants researched a little bit more, he sends it to me and I dig in. So we really started to find a good balance, but it's a transition that I don't think is always talked about. The second one is building community outside of our family, and there are so many places, of course, at the PPMD conference, with our son's friends, with our friends, and then also within the school system. The school system has been a major part of our experience with Ben. We were fortunate that first we have a school that works closely with us. They don't give us everything we ask for, but they're willing to partner and have the conversation. A second advantage is that we had a daughter that had already gone through that school, so that we knew some of the people. This allowed us to start the conversation early with the school, and it also really allowed us to introduce him to Ben and talk about who he was before we jumped into all the diagnosis. So we tell him what sports he loves and that he loves Legos, and he's a pretty funny kid, so I'm sure he'll crack a joke. So we really were able to focus on who he was and then what he needed behind that. I mentioned starting the conversation early. Sometimes I have to pace myself to say, too early, Jen, don't make the call yet, too early. We're getting ready for that middle school transition, which is a big one. Now that we're starting to go into the middle school space, I've asked Ben to help me start having those conversations. So recently we went to the middle school, and as we were starting to go to the middle school, I said, okay, Ben, what things are you thinking about? I know he had mentioned a little tidbits to me about, well, what if I get a tardy? Or how will I get in my locker? So I reminded him of those things and said, here are some good questions to start, and then I'll follow up with some other questions that I have. Also, when I suggested this meeting to the school, the first thing they said is we do our 504s and IEP meetings 2 days before school started. And I talked to some of my mom friends, and I came back and I said, you know what, that's actually not what I'm talking about. I'm not worried about the paperwork. Ben's spending all summer, like every child transitioning to middle school, thinking, how do I navigate the school, and how will I get in and out of these rooms? But he has an added layer of complexity. So I reapproached and came back and said, you know, I don't care about the paperwork. I just want to give some familiarity, and for him to meet his new school nurse so he can have know when he has a question who he can have that conversation with, which that was very successful. And then the last piece, Jason Burton mentioned this earlier today, to give back. And I'll tell you, if there's anybody who doesn't really have time or capacity to give back, it's probably us. But I ask a lot of my school, and I know that I ask a lot of them. So when an opportunity comes and I can see that there's a gap not filled, I'm happy to step in. I also have found when I've spent 2 hours at the book fair, I get to spend time with the teachers for next year, and I start to build that relationship with them, and then it makes it so much easier to step into that conversation when we go to the school year, because I already have spent some time with them and talked with them. So I would look for meaningful ways to give back. I'm sure, as you have all found, that building this community around us really makes this not only a better experience for us and makes us feel so supported, but it also gives back in so many ways that really just fills our heart. So thank you.
Thank you so much, Jen. There's so many practical things, again, in that 5-minute snippet, the things that matter to you so much, and just so practical about helping the school be prepared. And it's often not the things that they think is important, but until you can kind of communicate those things, and we've talked a lot about needs and asking for help, and being really clear about what your son needs in the school environment is something that they probably haven't even thought about. So being able to have those conversations earlier than you think you might need them gives them time to adapt, because Ben's probably not going to be the only one in that school that needs that kind of help, and so they're then better equipped for the next child, the next person that comes in. So thank you so much, Jen, for sharing what matters most to you. To you, Jen.
Hi, everybody. My name is Jen Tullio, and I'm going to talk about getting help. I have been part of the PPMD community for almost 20 years. I have twins. One is my girl Emma, and then my son Grayson, who has Duchenne. He actually just turned 21 years old 2 weeks ago, so he's here with us at the conference. So just from the very beginning, and talking about getting help, I was like any typical mom. I took care of most of Grayson's needs, as any mom typically does. Early on, my days looked much like the same as any other mother's, regardless of whether their child had Duchenne or not. But as we all know, the needs of our children with Duchenne change significantly over time. Rather than needing us less as they grow, they need us more physically and emotionally. In those early years, I rarely accepted help. Grayson grew accustomed to me as his primary caregiver. The familiar refrain in our house was, well, Mom doesn't do it that way, whether dad, sister, or grandparent tried to help. This became our norm and our routine we were very comfortable with. Then last May, our world turned upside down when I was diagnosed with breast cancer. My first thought upon hearing the diagnosis was, what about Grayson? Not my health, not my work, but Grayson. How on earth was he going to handle this change in our life? I must say, Grayson took it like a champ. He showed incredible resilience, strength, and grace, even when I couldn't get out of bed after treatments. But hearing him cry because Mom wasn't the one doing the shower or putting his sleep mask on broke my heart. I felt helpless and guilty, realizing I had done a disservice to my son. It was during this challenging time that I appreciated the support system we had. My husband stepped up even more and took on new roles with patience and love, proving that we are stronger as a team. Our daughter and Taylor and our extended family rallied upon us, offering support and love in countless ways. If there's one important lesson I learned from this experience, it's the value of asking for help early and often. For your sanity and the well-being of your child is crucial. We all know how much our sons with Duchenne dislike change, but we must help them adapt and become more comfortable receiving help from various directions. This could be as simple as rotating shower responsibilities, sharing the bedtime routine, household chores, you name it, but share those responsibilities. I hope by sharing this story, I can save another family and another boy with Duchenne from experiencing unnecessary anxiety and stress that we went through. Our journey has taught me that mom doesn't have to be the only superhero. It truly takes a village to battle the life of Duchenne. Thank you all for being here today, for supporting each other, and for being a part of this incredible community. Remember, it's okay to ask for help. In fact, it's essential. Our boys deserve the best care from a team of loving, supportive people, and so do we. Thank you.
Thank you so much, Jen. And this is a topic that's come up again and again through many conversations I've had with parents, just asking for help, asking for support, and releasing yourself from that pressure and guilt that you often feel as primary caregivers, as mums. I thought it was incredibly courageous how you said, we're doing our sons a disservice if we hold on to that control. And while it comes from a really loving, well-meaning space at the beginning, it can turn into something that becomes an additional burden. So bringing more support around you is critical, and thank you so much for sharing so honestly your experience, Jen. Thank you. Alrighty, I'm going to head to Limca now.
Hi, everyone. My name is Limca Jhaveri. I'm from New Jersey, and I'm actually going to be talking about the impact of clinical trials. I have 3 children. My daughter is 14. Her name is Shyla. My son, Jalen, is 12, and he has Duchenne. And I have a 4-year-old son named Dylan, and he's not affected by Duchenne. And Jalen was diagnosed when he was around 3.5, and we came back from from the hospital visit with no hope, no trials, no treatments besides steroids, and he was so young that we were scared of steroids. And fast forward, the worst thing was that he got diagnosed with Duchenne, but then also he had a very rare mutation. He has a duplication of exon 46. So there really wasn't anything for him at that time. Fast forward 9 years, my son is 12 and a half years old now, and he is in his 3rd clinical trial. So, there is a lot of hope. We were really hopeless at that time, and now we have seen so much from these trials. So I've had 2 different trial experiences. My first trial was a non-mutation specific trial, and I'm a healthcare professional. I'm a nurse by background. I've been in the pharmaceutical industry for the last 18 years, and I thought, I've got this. I know the process, I know trials, I know how to get in. Boy, was I wrong. That was not how it worked out for us. My son had to be 5 at the time, so at 4.5 we started steroids, and we tried to recruit him into a trial. We called and emailed the site that we were interested in for about 3 months. We knew the trial was going to recruit around that time before he was 5, and we got no response. It was like the black hole. So around a month after he turned 5, we got a call back from the site saying that, we got all your messages and we want to screen your child. The one key takeaway here is that just an email back from the site would have been nice to say that, we got all your messages. So that's one of the key takeaways. This trial had a lot of demands, as like any other trial, 2 biopsies, a lot of MRIs, a lot of blood work. And when the screening was happening for the trial, just to get into it, there were a multitude of tests, but there were 2 tests that we had to take, the 2 6-minute walk tests. My son passed the first one, and he didn't pass the second one. He missed it by a few seconds. And then we were crushed. I was devastated. I was almost about to cry. And my husband, in that time, somehow decided that he was going to go through the protocol. And the protocol said the average of 2 tests. So at that point, the investigator told us that he didn't make it into the trial. However, it was an average of 2 tests. So that meant that he made it into the trial. So roller coaster of emotions there. So another key takeaway there was that we really need to train our sites to really know these protocols inside out, because we would have walked away from that opportunity if my husband didn't look at the protocol. And then, unfortunately, after a year and a half of this trial, the trial ended, and we found out from Facebook. And we know the age of social media, information gets passed around. It was a global trial, so the UK parents found out before us, and we were on the Facebook page, and we found out. And then when we ended up calling our clinical coordinator, they weren't aware that the trial had been terminated. And we got a call back from the investigator about 3 days later. So another key takeaway there was that we have to make sure that communication is such a key for these trials, and especially if we have a negative trial, to really make sure that we kind of look back, that we are all the humanity in these trials, right? We have given so much to these trials, but really making sure that there's some sort of compassionate communication to these families, and to make sure that they are aware that, you know, we put a lot of effort into it. And we knew it was an investigation, so we all knew that, you know, this is an investigational drug, so it may not work out, but it would have been nice for that communication. My second trial, completely opposite experience. We were around 3 weeks before my son's 8th birthday, we got the call to recruit into the Sarepta gene therapy trial. The coordination, the care that we got nationwide, and the communication was exceptional. However, despite all that, the demands of the trial were a lot. We got the call 2 days later. We were down there testing for AAV antibodies. We came back 2 days later. We didn't have antibodies. 3 days later, we moved down to Ohio for 5 weeks. We had to leave behind our 9-year-old daughter, and I think these are the silent heroes of this whole. We don't think about our siblings that are involved here. My daughter had a very difficult time. She was 9 years old, at a very impressionable age, and we had to leave her for 5 weeks. And she was crying the entire time. And the second part of the trial landed during COVID. So that was another challenge, and they had us move down for 3 months. Now, I was pregnant. I had a baby. He was 6 months old at that time, and my daughter was 10 at that age. And at that point, we had to keep them home for 5 weeks because of potential viral shedding. So we had to leave them behind for 5 weeks with with their grandparents. And we made it through. It was chaotic, but the realities of a trial, your kids can get sick, because after the infusion, my son did. And he had a really tough 8 days after the gene therapy, but everything turned out fine. But the care was exceptional. I mean, we were with Nationwide with Dr. Mendel, and he was extraordinary with us. So we had very different experiences for both of these trials, and my son is now in his 3rd trial. He's part of the Edgewise trial, part of the cohort of gene therapy patients. And we are just 2 months into the trial, and we're having a great time still. We're okay. But one of the things I did really want to say for the trials is to make it fun from the beginning. My son was 5 when he first started his first trial, and it was our goal to make sure that we wouldn't focus on the visits, the biopsies, the MRIs, and all of that. Our goal was to really make him enjoy and remember the day in things that he enjoyed to do. So my son loves Asian food. So wherever he goes, he finds all the hot Asian spots. So he was involved with finding the restaurants. He loves museums. He loves nature. So after the trial visit, we would make sure that he would have those experiences. And now, if you ask my son, when the gene therapy was approved last week, he was like, and I told him, I was like, you know what? You are a hero to me. Everything that you have done, and he's like, no big deal. I did nothing. And it was like, he is resilient. And another thing I would like to say to everyone here, my son has ADHD, he has anxiety, he has sensory issues, he has OCD. He has it all. And he was exceptional throughout. We just have to make sure as parents to really dwell on what works for them and what doesn't work for them. The hardest thing for him for the trial is the sticky patches for EKGs. He hates them. He hates taking them out. He doesn't like anyone pulling them off of him because he has he's a lot of sensory issues. So just making sure that we advocate with all the staff to make sure that they know our child and to make sure that he has fun through the process. That's the biggest take back that I say. And then the impact of the trial, our quality of life. So after our second trial, I have to say, our life changed. We went from a family talking about, accommodations and school accommodations to a family that really focuses on being a family. My husband and I do date nights. It's really, the quality of life has become really great for us. My son is able to stay home alone at 12 because we know that if there's an emergency, he can actually go down the stairs and get out of the house. He's able to go to friends' homes because he can, he's able to do things. And it's been really great. And, I really have to say thank you to so many people. The pharma companies who have invested in all these trials, also to PPMD and all the advocacy groups that have actually invested in Duchenne over these past 30 years, but also the families that came before us, because I would not be sitting up here in my third trial if these families did not advocate for us and raise money and raise awareness and advocate for everything that we are. So we've had this opportunity because of them and to all the families that have been involved with these trials. So that's something that I would like to really share.
Thank you so, Limca. It's so interesting hearing your different perspectives and those different experiences and the impact of those experiences from the not so great into what makes an experience really meaningful, and that even though it was pretty hard, like it sounds very difficult, that you have those memories together and you could still make it fun. I think that's a really beautiful thing to take away from that time together. Thank you so much for sharing. All right, I'm going to head to you down the end there, Chris.
Yes.
Thank you.
Thank you. My name is Chris Cate, and I'm from Cincinnati, Ohio. I'm married to Tammy Cate. We have been married for 24 years. We have a son, Seth, who is 18 years old, who just graduated high school, and so very proud of him completing his schooling there. Now, a couple things they asked me to share with you was, where do we find hope? And throughout this whole conference, you've heard hope, you've heard a lot of different things. And so there are 3 areas that our family really focuses on for where we find hope. And first thing that we find hope in is our religious community. We believe that being involved in a religious community, whatever faith you have, is very important. Not only are we getting religious, spiritual advice, but also a part of that, we're volunteering. We're taking a time to serve others versus us being served. So during that time, we're forgetting about our own problems and we're serving others. So that is one thing that I encourage folks to be involved in, is a religious community somewhere. Now, a lot of our churches may not be accessible. It took us a while to find a church that was accessible. Many of you know that I work for a church, and it's difficult sometimes. But we come alongside of the church and go, here is where we can get our boys, our daughters, our children involved in the church. So I encourage you, 1, to find hope in spirituality. Number 2, to find hope in connect groups. Throughout this week, you've heard many times connect group. We don't have a lot of people involved in connect groups. We're in Cincinnati, one of the largest areas, in Cincinnati Hospital there. Folks, these connect groups are an extension of what happens here. We get to experience life together. See, life was not designed to be by yourself or alone. Even though society, the world has says you can do this on your own, you can't. That's why we have these conferences. That's why we have these events. That's why we have connect groups. So I really encourage you, when you go back home, find the connect group that is in your area. Now, moms, my wife will get phone calls 3 o'clock in the morning, 2 o'clock in the morning, of a mom that's finally ready to talk. It's okay. That's what these connect groups are here for. They're here to listen. Now, us dads, we love to solve problems. I guess that's why they don't call me, because I'm trying to solve the problem. But moms, they're here to listen to us, listen to you guys. So the other thing that we find in our Connect groups are wisdom. A lot of our Connect group leaders have been in this for 10, 15 years. We have resources. Don't go this alone. Remember at the very beginning here, we said it's us. It really is us in these Connect groups. That's what it's about. And the third thing that we find hope in is the research and the information. See, we started about 13 years ago with Duchenne muscular dystrophy, and I still remember today that when we got that diagnosis, it crushed our life. I remember that we found this association called PPMD, and we were at Kings Island getting ready to go right into our first visit, which those who were in this for years ago, it was 5 days with Dr. Wong up at Cincinnati Hospital. Thank the Lord we're down to 1 day now. But I remember Pat Furlong calling me. We were actually coming out of a theater, and I go, oh, Tammy, we're going to have to answer this. This is Pat. And Pat spent about 5 minutes on the phone saying, this is what you need. Folks, that's what PPMD is about. So not only about connecting, but also the research. You all have heard some amazing things coming down the pipeline. 13 years ago, I just remember, will steroids work? Put all the boys on steroids. That's what we had. And of course, Dr. Google. I love the other thing. Pat said, do not Google. If you Google, you'll just cry. And we Googled, of course, and we cried. We sat there and cried for hours. But the drugs that are coming down the line. Now, the second part of that is the information that PPMD has. Folks, again, 13 years ago, we were just talking about steroids. Now we're talking about carriers. Now we're talking about siblings. Now we're talking about all these other things that back then we were just looking for what is that first hope that we had. There's so much hope in our community right now, and it's very, very exciting that we have. So those are the three things that I want to focus on there. Now, there's one other very important thing that we really haven't talked about in this event, and this is men's mental health. Guys, we struggle. We, a lot of times, I feel, internalize what's going on, and we don't share with others. PPMD, myself, Brian Dinger, we need to hear how can we help dads. Now, we've been asking this question for years, but it's a hard nut to crack, as one of the PPMD folks said. Because guys, seriously, we are hard. We build these walls up because we are supposed to be that person that just doesn't give. And we also are men who find solutions. But guys, we need help. We do. We need to find that outlet where we can connect with others, but not only that, pour back into our families also. Because our wives need us, our kids need us. So earlier this week, I did a quick just kind of poll of what do men do to check out or how do they handle mental health. And many of the responses were, Chris, we don't know what to do as dads, as men. But some of them were, another guy, he goes hunting. So he'll leave, he'll go out about 3 days, 4 days, and he'll actually go hunting and be able to check out completely. Another guy lifted weights, he did heavy lifting. Another guy was running, he would do marathons, he would do things. Now, the way that I check out is I'm actually a purple belt jiu-jitsu artist. So I can legally choke people out and not worry about it, and then I can go home, okay? So that's the way that I kind of check out. The other way that I do it is my wife and I have just started walking. We go out and we walk a couple of miles a day. So that allows us to be able to kind of recheck out for a second and then be able to pour back into others. So I encourage the men in the room. There is a Connect group for men that Brian Dinger leads, and it's a couple of, I guess it's a couple of times a month that they have this. But I encourage you men, find that mental help that we need to help keep us strong.
So good. Thank you, Chris. Some really powerful things that you shared there, and I've had the great privilege of speaking to a number of the dads at this conference, and you're right, like you're holding it all together but silently often and quietly kind of falling apart internally and not knowing what to do with all of that. So I'm hoping that we can open up the conversation now if anyone has any questions for our panelists. And the panelists have also said that they're willing to have one-on-one chats with anyone if you want to connect with them after this session. And I think, especially to your point, Chris, if someone is interested in joining a Connect group, how would they do that, Chris? How would they do that?
Oh, how they do that? Yes. So Nicole is our leader, the lady that we go to. But I would go to the website, and there's Connect groups there for almost all the states. I think we have a couple of states that don't have a Connect group leader. But if you're near a state, it's okay. Connect with that group. And even if you can't come to the meetings, at least join the Facebook page of those Connect groups, because important information comes out there.
Excellent. Thank you so much. If anyone has any questions, we have some microphones at the front of the room here. But while people are joining, I wanted to come back to something that you said at the beginning, Claire, when you're talking about one day at a time. And I don't know if you got to share this story, but you shared it when we were first, planning this panel, and it was around how much your son loves race carts. Can you share that story?
Of course, yes.
you.
So in his tenure as a Cub Scout, Luke has been able to participate in the Pinewood Derby race car, and he just was able to, like I talked about before, he just loves anything to do with engineering. So he got to design a race car with Scott. He got to figure out what he wanted design. He wanted to paint it. He got to figure out how to put the weights on and how you glue them on to make sure that the car would go fast. And he got a lot out of that, and just participating with his Cub Scout troop and just getting that experience, I think, with his peers, because we were, part of the reason why we were so worried about this diagnosis was wondering how he would fit in with his peers. And I know we're early on the journey, but just seeing how he's forging those friendships and participating like every other boy right now has just been so rewarding.
Beautiful. Thank you. Thank you so much. Alrighty. Well, have you got any other things that you want to share with this crowd that you think, I just wish I'd said one more thing? Beautiful panelists up there. Is there anything left unsaid? I see you, Chris. I
know.
see you.
I'm sorry.
Yeah.
My wife did not know that I was struggling, and this is something really important.
Yeah.
Christmas, every year, I wondered if it was the last Christmas. My job is to put the tree together, fluff it, and then to light the tree, and then my wife decorates it. So every time I put a tree up, I would cry just a little bit, thinking, is this the last Christmas? Man, I held on to that for 10 years, 12 years. I finally this year told my wife, you know what? I struggle at Christmas. Is this the last Christmas? She said, thank you for telling me that. She thought I didn't struggle. She thought that maybe I just looked at it differently. So men, share with your wives what you're thinking.
Thank you so much, Chris. Thank you. Thank you. I want to honor all of you for joining us and being on stage here and sharing your stories. It's not an easy thing to be so vulnerable and courageous, and I want to give them all another round of applause for being so open. And thank you all so much, and I hope you have some conversations with those around after this session. Thanks, everybody. Thank you.